So this is how I designed my new patient paperwork. So I took, the medical history stuff and all that stuff and kind of put a little bit of the patient experience into it. And I added my testimonial waiver, my consent to treat, and also the notice of privacy practices. So pretty much I wanted to create some sort of user experience because most times when you're filling out new patient paperwork, it sucks, it's monotonous, and no one reads over anything. So I tried to simplify it as best I can, but yet still kept the legal standards going. So this is an example of my fillable PDF version of the new patient paperwork. The patient information sections, pretty much textbook. We do ask whether they have an HSA or a flex spending account because they can use that here at a cash-based clinic here. So and we ask the yearly deductible just so it gives us a idea during the eval of what is this person's out-of-pocket max too. So that's what our new patient information form looks like. Down here is the diagram. This is textbook PT stuff, so nothing really new there. So in the state of Florida, we have 30 days direct access if they've never been seen by a practitioner of record. So one of the ways besides our history taking during the eval is to document if they've ever been seen by a practitioner of record. I added this into my new patient paperwork here. So these are our practitioners of record that are in our Practice Act. So before I even do the eval, if I ever get audited and they're wondering why I'm seeing this person past 30 days, right here it is, bam. So it's another, not necessarily a touch point, but another proof of documentation. Before I even do the eval, the patient already said that they've been seen by a practitioner of record. So that's why I added that in there. And then we have some other questions here with typical history of pain. What makes it better? What makes it worse? When did symptoms start? Any medications? Down here, we do ask a commitment question. This is something I added in because patients that circle at 8, 9, or 10 normally end up getting a good outcome. And the PTs, we are trained to identify if someone circles anything less than 8, we know that during the EVA that we have to dig deep and kind of bring out why that person only wants a 5 commitment of getting better. And we have to dig deep and kind of highlight that because if someone's only a 5, they're not going to pay $3,000 for treatment. So I did ask this commitment question in there just to kind of, for us PTs, to screen those prospective patients during the eval. Next, past medical history. We go over all the stuff, typical stuff, standard stuff, to explain anything with yes above, any allergies, any surgeries, and they sign here authorizing that this is accurate information. So typical medical stuff. So since we are a cash-based practice, this is our payment for services rendered. This is what we wrote out so the patient knows exactly what that they're required to pay for. And then we also added a clear statement in here about our money back guarantee for treatment packages, and they signed that. Emergency contact information if anything does happen, typical stuff. Here's our testimonial approval form that allows us to share pictures and testimonials and stuff like that on social media. Our cancellation policy, this is just so they get a chance to read over this before they end up coming in here. This is our cancellation policy. Again, we don't have a lot of cancellations. We kind of solved the root cause of that, but this is mainly to go after those habitual cancelers that will like call the day and schedule an appointment the next day and then text saying that they can't make it because of something. So the people that habitually cancel, which is only like 1 in 40, but that's our cancellation policy. And the last 2 sections are pretty much informed consent to treat, to do an eval and treatment, and they sign off there. And then they acknowledge that the notice of privacy practices is another document that we give them if they want to read it. It's a great read, but I had a lawyer design that for me and my consent to treat. So this is a breakdown of my new patient paperwork. If you have any questions, just put it in the comments below. And if you're looking to get all of this done for you and have access to this, you can click the link below to look at the Business Essentials course and see if it's a good fit for you. But this is the breakdown of my new patient paperwork.